And our next speaker is Dr. Margaret Sirolli, who is a veterinarian, and she got her Master of Public Health with the University of Minnesota. Currently, Dr. Sirolli is a veterinary public health resident at Center for Animal Health and Food Safety, University of Minnesota, but previously, she worked with the United States Food and Drug Administration, with global food companies, and more recently, she worked with the Minnesota Department of Health on COVID-19 response. So, Margaret, the floor is yours. You are muted.
Can you? Yes, I think I figured it out. You can hear me? Fantastic. Thank you so much. It is a pleasure to be here. And my dear colleague, Dr. Valeria, just congratulations on putting this together. I'll echo my colleague, Dr. Perez's statements earlier. This is quite a testament to getting this put together, and I am honored to be here. So thank you. I'm going to speak this morning about an emerging one health issue, but it's particularly an emerging issue in the veterinary world, an antimicrobial resistance issue. And Dr. Alexander, I appreciated the way you addressed the need to shift some of these conversations, not only from human, but then shifting them to agriculture and shifting to wildlife. And now shifting, actually, this is going to be a discussion around antimicrobial resistance in a companion animal population. So that is not forwarding. There we go. Antimicrobial resistance, I believe we are all well aware of the issues related to antimicrobial resistance. The World Health Organization definition is listed on the screen. Essentially, the resistance results in making infections harder to treat and increases the risk of disease spread, severe illness, and death. It is described by the World Health Organization as one of the top 10 global public health threats, leading to over 1.2 million deaths per year. And in the United States, it's estimated to result in $4.6 billion of additional healthcare costs just to treat the top 6 antimicrobial resistance threats. This is very clearly a One Health challenge for human healthcare, animal health, as well as the environment. So I won't spend a lot of time on this slide. This is a graphic by the by the World Health Organization. And I just want to highlight these are the causes of antimicrobial resistance highlighted by the World Health Organization: overprescription of antimicrobials, as well as patients not taking, or in the case of our companion animals, not being administered medications as prescribed. And then the last bullet, the lack of rapid laboratory testing available to identify antimicrobial resistance, leading to more broad spectrum antimicrobials being prescribed when a more narrow scope antimicrobial would be just as sufficient and better for this situation. So I'm going to speak specifically to Carbapenem-resistant Enterobactereales. The U.S. Center for Disease Control and Prevention define CRE as an Enterobactereales microorganism that is resistant to at least one carbapenem antibiotic or produces carbapenemase. And carbapenemase is an enzyme that the organism produces that hydrolyzes carbapenem antibiotics and therefore rendering them ineffective. The carbapenemase can also hydrolyze other beta-lactam antibiotics, such as penicillin and cephalosporin. And the subset of CRE that produce carbapenemase, approximately 30% of those organisms carry a mobile carbapenemase gene, therefore allowing them to transfer that resistance to other microorganisms. So carbapenems are beta-lactam broad-spectrum antibiotics. Essentially, these are drugs that are used as a last resort, typically reserved to be used as a last resort when treating multi-drug resistant gram-negative infections. The drugs listed there are the 4 that are approved for use in the United States. Enterobactereales were previously identified as Enterobactereaceae. In 2020, the nomenclature changed. These are gram-negative bacteria that are normally found in the digestive tract of humans and animals, and they are becoming increasingly hard to treat due to resistance among these organisms. Examples of such are E. coli, Klebsiella species, and Enterobacter. CRE was identified as an urgent threat in the 2019 threat report published by the US CDC due to its impact on human health and high mortality rate. Over 1,000 deaths per year are attributed to CRE infections, as well as just over 13,000 hospitalizations in the US. And again, adding to the threat of this resistant organism, is this ability to transfer that resistance to other organisms. In addition, CRE has an added complexity. Not only will CRE cause infections, which would result in clinical signs of disease with symptoms and would make those aware that of an infection and need for treatment. But there's also the potential for colonization of animals and humans with this resistant organism. So therefore, no clinical signs or symptoms, and it allows for this organism to be silently spread in the community. High-risk human patients, and again, Dr. Alexander, I appreciated your acknowledgements around many of these issues are very focused on human health. And unfortunately, many of my slides in this presentation are addressing human health because there is so little known about CRE in animals and in particular companion animals, but we will get there, and I will share a case example as we go through. So high-risk human cases, or those that are at higher risk for CRE, are those that have had healthcare exposure or antibiotic exposure. And that's described by the Center for Disease Control as those that require help, intensive help with daily living activities, such as bathing and toileting. Those that have been hospitalized in an intensive care unit, received mechanical ventilation, or received healthcare outside of the United States. In addition, antibiotic exposure to carbapenems, cephalosporins, fluoroquinolones, and vancomycin also have been indicators as those who have at a higher risk. In addition, multiple antibiotic exposures to these antibiotics, as well as extended courses of treatment to these antibiotics, increases the risk with each subsequent course of treatment. In addition, I mentioned the colonized individuals. When those individuals are treated with an antibiotic, they also have the potential to disrupt the microbiome in that particular animal or human, and then therefore increasing the number of CRE within the system, leading to the potential to develop a CRE infection, and also increasing their potential to spread the resistant organisms. Transmission of CRE is in humans is most associated with healthcare settings, direct transmission between people via the hands, and then as well as indirect transmission via contaminated medical equipment. Transmission is also possible due to identified environmental reservoirs. Sink drains and toilets end up being environmental reservoirs that are a challenge to address. Transmission can be prevented through appropriate infection prevention and control measures, such as good hand hygiene, contact precautions, which is the selection of appropriate personal protective equipment, and as well as appropriate environmental cleaning and sanitation. So I mentioned this was going to address CRE in companion animals. So why do we care about CRE in companion animals? Well, first, it's clinically relevant, and we want, as a veterinary profession, to be able to treat our patients and have effective therapies for our patients, as well as we need to be aware of our prescribing practices. In veterinary medicine, many times our patients are prescribed broad spectrum antimicrobials because many times culture and susceptibility testing is not done for a variety of reasons, whether it's lack of access, time, or the cost. And so many times our companion animals are prescribed broad spectrum antimicrobials when a much more narrow spectrum treatment would have been appropriate. And also, in addition, we care about CRE because these animals are in homes. They are sharing the same space with our families. They are many times considered part of the family. And studies have shown that in households, the microbiome between all those within the household actually are very similar. I don't believe that any snakes were included in those studies, but I'd be curious to know if the microbiome of any pet snakes would be similar. I would expect there is that potential just because of transmission. So that's an interesting thought, but that was not included in the studies that are listed here. CRE has been reported in companion animals around the globe, as depicted by this graphic. And this graphic is a few years old now, so many more have been identified at this point. I'm going to touch briefly on a case example of CRE in a dog that I had the opportunity to be involved in the response effort here as part of my training program. And I just wanted to share a little bit about it and help to highlight why this is an issue. We had a male-neutered 1-year-old mixed breed dog that in April of 2021 was hospitalized as a result of a gunshot wound in the Middle East. The animal had received surgery in the Middle East, as well as fluoroquinolone antibiotics. The dog was imported into the United States in June of 2021 by an animal rescue group that was on a bordering state of the Minnesota. An animal rescue, this organization brings in animals and they live in a shared space. And this facility had a large number of these animals, with 37% of them, the dogs that were in their facility had been imported to the United States over the last 10 years. The animal was presented to the Minnesota Veterinary Teaching Hospital in July of 2021 for reconstruction as a result of a non-healing wound, implant removal and treatment. Again, the animal was treated with fluoroquinolone and amoxicillin clavulanic acid at that time. So I can't see this entire timeline, so we're just going to wing it from memory, because the way my screen is showing at the moment, many things are being blocked out by your beautiful faces and the control tab line, but we're going to go for it. This slide represents the timeline of the patient from the initial injury in April of 2021 in the Middle East, when the patient arrived in the United States and was imported by the rescue organization, to the first treatment at the Veterinary Teaching Hospital in July of 2021. And then between July of 2021 and February of 2022, it illustrates the 5 admissions that this patient had over that course of time to the Veterinary Teaching Hospital for various treatments and surgeries, and those included antimicrobial therapies along with them. And then over here all the way at the end, but I can't get my cursor there. In February of 2022, after attempted treatments of a non-healing, the wound not healing, the animal had a culture and sensitivity test done at that time, and it was identified as having CRE E. coli organism in the wound. And this highlights the need to shift our thought process around antimicrobial resistance as not being just something in human healthcare, and not just a challenge for our agricultural animals as well, but also for our companion animals, and for specifically for the veterinary community to be aware of this issue, because as you'll see indicated on the bottom part of this timeline, in July of 2021, when this animal was, after this animal had been brought to the United States, a primary care or what we call a referring veterinarian had seen this animal first prior to coming to the university's teaching hospital. And that referring veterinarian had actually done a culture and sensitivity on this patient. And in that culture and sensitivity report, it had been identified as having an imipenem-resistant E. coli microorganism. But this was not flagged by the referring veterinarian because they were simply unaware of the challenge with this organism. And then in addition, that paperwork was presented to the Veterinary Teaching Hospital. And again, unfortunately, the importance of that laboratory result was not identified. And therefore, that patient came and visited multiple times over the course of several months, and that laboratory result was not made known. So awareness of CRE in companion animals is of importance and is a challenge. CRE resistant Enterobactereales is a concern for public health and veterinary medicine. There are multiple cases of and scientific reports now that have been published most recently in the last few years of CRE in US dogs and cats. However, still the incidence is not well known. And again, you know, when we were going through this situation, very little CRE information was out there related to veterinary settings. I would like to note the US Center for Disease Control and Prevention does actually have a fact sheet available for veterinarians as well as pet owners, which is very unique. There aren't very many of those resources available in the companion animal side. The risk for animals, companion animals, is most likely similar to the risk for human cases. So referral facility, hospitalizations, and extended treatments with antimicrobials. There are a few unique challenges related to veterinary medicine, specifically, common elimination areas in those referral facilities, those areas where you take the pets outside and allow them to relieve themselves, as well as the reuse of medical equipment. Many times endotracheal tubes are sterilized and reused, and that is a practice that's not done routinely in human medicine. In addition, this is a challenge, as I mentioned before, because of low veterinary awareness. I will be honest, at this time last year, I was not aware of this situation. In addition, I was not familiar with carbapenem drugs. These drugs are not commonly used in veterinary medicine, and I don't believe that they were available when I went through veterinary school. So this was a completely new class of drugs to me, and this issue was not something I was aware of. And I've spoken to many of my veterinary colleagues, and they as well have not heard of this issue. So to be aware of this, especially because of the potential for colonization, leading to that silent spread and community spread, and the potential for it to spread within the household, is something that we really need to work on bringing attention to. In addition, carbapenem-resistant organisms are not reportable in animals in all our states. So that's when you have a pathogen of concern that is required to be reported to state and local and federal authorities. That is not a harmonized approach across the United States, and is actually can be localized and regionalized in that requirement. For example, in a referral veterinary center in Pennsylvania, they had a month-long transmission of CRE within their veterinary hospital before it was finally recognized. Again, just unaware of the situation. And when it was identified, they found out that CRE in animals in the state of Pennsylvania was not reportable at the state level. However, Philadelphia, a city within the state, CRE is reportable in animals. So many key learnings and opportunities for awareness. So in summary, antimicrobial resistance is a global One Health challenge. We need to practice judicious use of antimicrobials to ensure that we have effective medications for both our animal patients as well as human medicine, and to prevent antimicrobial resistance from developing. Carbapenem-resistant Enterobactereales have been identified globally in human and animals. As well, we need to be aware in veterinary settings of CRE and the potential risk factors that would be identified as risks for our animal patients. And finally, it's important to just, again, as Dr. Alexandra, I felt like you kept hitting on so many points that I wanted to highlight as well. Biosecurity, implementing appropriate infection control and prevention measures on a daily basis, not only in our human hospitals, but also in our animal hospitals, whether they are a primary care veterinary clinic or at a referral center, is important to help prevent the transmission of these microorganisms, as well as other pathogenic organisms. I do want to acknowledge want to acknowledge the team. I want to acknowledge many of these slides were put together by Dr. Amanda Bedoin and Dr. Jennifer Granick. They led the response to this situation in the veterinary clinic, as well as my colleague, Dr. Valeria. She also helped me put together these slides, and I am so helpful. The infection control team at the university, as well as the Center for Animal Health and Food Safety, where I'm currently in the resident veterinary public health and preventative medicine residency program. Those are some resources, and I will finish with that. Thank you for your attention. I appreciate it. And again, Valeria, congratulations on putting this together. Thank you for the opportunity.
Thank you so much, Dr. Sirolli. It was a pleasure to having you today. Once again, regarding questions, please use chat function, use email function. We are ready to address them afterwards. And yes, we are a little bit late on time, so I would ask our next speakers just to hurry up a little bit. So thank you. And Dr. Galat, maybe